If you are over 60 and you ever eat alone, there is one emergency you need to think about before it happens. Not because you should live in fear, not because every meal is dangerous, but because choking is silent, fast, and confusing. And when you are alone, the first few seconds matter more than most people realize. Most people think choking looks loud. They imagine coughing, shouting, waving for help, or making enough noise that someone nearby will notice. But real choking can be frighteningly quiet. You may not be able to call out. You may not be able to explain what is happening. You may not even have enough air to make a sound. And the most dangerous part is this. The first mistake many people make feels completely natural. They reach for water. They try to swallow harder. They wait a few more seconds, hoping the food will go down. But if the airway is truly blocked, those precious seconds can slip away fast. Here at Built After 50, we focus on clear, practical health guidance for adults who want to stay independent, confident, and prepared. And today, I want to walk you through what to do if you start choking while you are alone, especially after 60. No panic, no fake miracle advice, no complicated medical language. Just a calm sequence you can remember before you ever need it. And please listen carefully until the end, because I will also share a simple 30-second habit you can do before eating alone that may make you far more prepared in an emergency. The phrase I want you to remember today is simple: air first, action fast. Because in a choking emergency, your job is not to be perfect. Your job is to keep air moving, get help if you can, and act before panic takes over. Think of your airway like a narrow doorway. Every day, food and air pass through nearby pathways in your throat. Your body usually handles this automatically. You chew, swallow, breathe, and never think about it. But after 60, that system can become less forgiving. The muscles involved in swallowing may lose some strength and coordination. Saliva may become reduced, especially if you take medications that cause dry mouth. Dentures, dental problems, or eating too quickly can make food harder to break down properly. And certain foods, dry bread, tough meat, nuts, rice, raw vegetables, or large tablets, can be more difficult to manage than they used to be. This does not mean you should be afraid to eat. It means you should respect the system. Because choking is not always about eating something unusual. Sometimes it happens with the most ordinary bite, in the most ordinary room, on the most ordinary evening. You are standing in your kitchen. The house is quiet. Maybe the television is on in the next room. Maybe your phone is on the counter. Maybe you are having a small snack before bed. You chew quickly. You swallow. Then something feels wrong. At first, it may feel like pressure, a stuck feeling, a tightness in the throat or chest. Your body tries to cough. Maybe a little air moves, maybe it does not. And in that moment, your brain begins searching for answers. Water, phone, door, bathroom, chair, sink, help. That scattered feeling is normal. It is your body reacting to danger. But this is exactly why you need a simple plan before it happens. Because a panicked brain does not need a long speech. It needs one clear command. Air first, action fast. The first thing to understand is the difference between partial choking and severe choking. If you can cough forcefully, breathe, or make sounds, air is still moving. That is important. In that case, your cough is your best tool. Do not try to drink water. Do not lie down. Do not hit your own chest randomly. Lean slightly forward and keep coughing with purpose. A strong cough can help push the object out. But if you cannot breathe, cannot speak, cannot cough effectively, or you only make weak squeaking sounds, treat it as a serious emergency. That is when you must move quickly. The first 20 seconds should not be wasted trying to see if it passes. You need to act. If your phone is within reach, call your emergency number immediately. In the United States, that is 911. In the UK, it may be 999. In other countries, use your local emergency number. Even if you cannot speak, leaving the line open may still help responders locate or respond to you, depending on your area and device. But here's the key. Do not walk across the house looking for your phone if it wastes time and makes you weaker. If it is right there, use it. If it is not, go straight to action. Remember the sequence. Cough if you can. Call if you can. Counter if you cannot breathe. That word counter matters, because if you are alone and severely choking, a sturdy surface can become your rescue tool. A kitchen counter, a heavy table, the back of a solid chair, the arm of a strong sofa. Not something light. Not something that will slide. Not something that will tip over. You need a hard, stable edge. Place the upper part of your abdomen against that edge, above the belly button, below the rib cage. Then bend over it and thrust inward and upward. Not gently, not slowly. Inward and upward. The goal is to create pressure from below the lungs, forcing air upward to help push the object out. This is similar in principle to abdominal thrusts, but you are using the edge of a counter or chair because there is no one behind you to help. Again, air first, action fast. And I want to pause here because this is where many older adults make the most dangerous mistake. They try water first. It makes sense. If food feels stuck, water seems like the obvious answer. For a minor stuck feeling in the esophagus, water may sometimes help. But when you are truly choking and air cannot move properly, drinking can make things worse. It can add liquid into an already dangerous situation, trigger more coughing, and waste time you may not have. So here's the rule. If you can breathe and cough, keep coughing. If you cannot breathe, do not drink. Move to abdominal thrusts immediately. Before we go further, if this information is useful, please tap the like button so this video can reach more adults over 60 who live alone or eat alone. And if you are watching right now, leave a comment with your age and where you are watching from. It helps build this Built After 50 community, and it reminds others that they are not alone. Now let's go deeper into the exact mistakes to avoid, because knowing what not to do can be just as important as knowing what to do. The first mistake is trying to swallow harder. When something is blocking your airway, forcing another swallow may not solve the problem. In some cases, it can make you feel more panicked because your body expects the food to move, but it does not. That failed swallow can make your brain scream, "Something is very wrong." Instead, stop trying to push it down. Your goal is not down, your goal is out. If air is moving, cough it out. If air is not moving, thrust it out. The second mistake is walking around the house. This is very common. A person starts choking in the kitchen, then they stumble toward the bathroom, the bedroom, the front door, or the hallway. They are not thinking clearly. They are just moving because panic tells the body to move. But wandering wastes strength, and in a choking emergency, strength is not something you can afford to spend carelessly. Stay near the strongest rescue surface available: a counter, a table, a heavy chair, a firm armrest. You do not need the perfect object. You need the nearest stable object that can take your body weight without sliding away. The third mistake is lying down too soon. When oxygen drops, your body may feel weak, your legs may tremble, the floor may start to feel inviting, but lying flat can make it harder to use gravity and harder to create the upward pressure needed to move the blockage. If you must lower yourself, do it with control. Use the wall, counter, or chair to guide yourself down. But as long as you can still stand and use a sturdy surface, use it. The fourth mistake is trying to be gentle. This is hard for many older adults because nobody wants to hurt themselves. Nobody wants bruising. Nobody wants to slam their abdomen into the edge of a counter. But in a severe choking emergency, gentle pressure may not be enough. The movement must be sharp, inward and upward. The goal is to create a strong burst of pressure. Think of it like pushing air from the bottom of the lungs upward through the airway. You are not trying to massage the blockage. You are trying to force air behind it. This is why the surface matters. A soft couch cushion will not work well. A rolling chair may move. A lightweight table may shift. A sharp, sturdy edge gives your body something to press against. Here is how to remember it. Find the edge. Place above the belly button. Bend over. Thrust inward and upward. Repeat if needed. Air first. Action fast. Now there is one more thing people often misunderstand. If you are alone and choking, you may feel embarrassed. You may think, "I do not want to call emergency services if this clears in a moment." You may worry about bothering someone. You may not want neighbors to see you in distress. Please do not let embarrassment make medical decisions for you. A choking emergency is not a manners problem. It is an oxygen problem. If you can call for help, call. If you can get near a door or make noise without losing time, do it. Knock something down, hit the wall, press an emergency alert device if you wear one. Activate voice assistant calling if you have it set up. But do not spend your entire window trying to be polite. This is your life. You are allowed to make noise. You are allowed to ask for help. You are allowed to act urgently. And if the blockage clears, you are not automatically done. This part matters. After a serious choking episode, especially if you had trouble breathing, chest discomfort, ongoing coughing, wheezing, throat pain, or a feeling that something still went down the wrong way, you should seek medical advice. Sometimes irritation, small injuries, or aspiration can cause problems later. Aspiration means food or liquid may have entered the airway or lungs. In plain language, even if you survive the scary moment, your body may still need to be checked. Now let's talk about why choking risk can rise after 60, because this is not about blame. It is not about being careless, and it is not about weakness. Swallowing is one of the most complex things your body does. More than 30 muscles and many nerves must coordinate in the right order. Your tongue moves food backward. Your throat muscles guide it. Your airway closes for protection. Your esophagus carries food downward. And then, almost instantly, your breathing resumes. When you are younger, this process feels automatic. After 60, it may still work well, but the margin for error can shrink. Dry mouth can make food harder to move. Dental changes can make chewing less complete. Dentures may reduce how well you feel and break down food. Some medicines can reduce saliva or make you drowsy. Eating while distracted can cause you to swallow before food is ready. Talking while chewing can interrupt the rhythm. Eating too fast can overwhelm a system that now needs a little more time. Again, this does not mean every older adult has a swallowing problem, but it does mean older adults should respect the mechanics of eating. Think of your swallowing system like an old, reliable elevator. It may still work every day, but you do not overload it, rush the doors, or ignore warning signs. You give it time to do its job. That starts with smaller bites. Not tiny, fearful bites. Just smaller than what you may have taken at 30 or 40. Chew until the texture is soft and even. Put your fork down between bites if you tend to rush. Take sips during the meal to stay comfortable, but remember, water is for normal eating, not for forcing down a true choking blockage. Sit upright. Avoid eating while walking around. Do not eat lying in bed. Be extra careful with dry bread, tough meat, popcorn, nuts, raw carrots, grapes, sticky peanut butter, white rice, and large tablets. And if you notice repeated coughing during meals, food sticking often, a wet-sounding voice after swallowing, unexplained weight loss, or fear of eating certain textures, talk to your doctor or a speech-language pathologist. A speech-language pathologist is a trained professional who can evaluate swallowing and teach safer techniques when needed. This is especially important if you have had a stroke, Parkinson's disease, dementia, nerve problems, head or neck surgery, reflux, or repeated pneumonia. Those conditions can affect swallowing safety, and the earlier you address it, the better. Now here's the part I want every senior living alone to take seriously. The best time to survive a choking emergency is before the emergency begins. That may sound strange, but it is true. When your airway is blocked, your brain is under pressure. You do not want to invent a plan in that moment. You want to follow a plan you already know. So before eating alone, do a quick scan. Where is my phone? Where is the nearest sturdy counter? Which chair is heavy enough to use? Can I reach help if something goes wrong? This is not paranoia. This is preparation. You do not buckle a seatbelt because you expect a crash every time you drive. You buckle it because if something happens, you want protection already in place. The same idea applies here. Before you eat alone, especially at night, keep your phone close. Sit upright. Avoid rushing. Cut risky foods smaller. And know your counter. That simple habit may give your brain a map when panic tries to erase your thinking. And remember the sequence. Cough if you can, call if you can, counter if you cannot breathe. That is the core of this entire video. Cough, call, counter. If you can cough strongly, keep coughing. If you can call emergency services, call. If you cannot breathe, use a firm edge for inward and upward thrusts. Simple does not mean weak. Simple means memorable. And in an emergency, memorable can save precious seconds. Now let's make this even more practical. Tonight, before your next meal, I want you to do the 30-second choking safety scan. Look at your eating area and ask yourself 4 questions. Where is my phone? Where is the nearest sturdy edge? Am I sitting upright? Is this food cut into pieces I can chew easily? That is it. 30 seconds. No fear, no drama, just awareness. If you live alone, this matters even more. If you care for a spouse, a parent, or an older friend, teach them this too. Do not wait until someone is in trouble to have the conversation. And if you wear dentures, take dry mouth medications, have had a stroke, have Parkinson's, have memory changes, or often cough during meals, be extra careful. These are not reasons to panic. They are reasons to be prepared. You can also make small changes that reduce risk every day. Eat at a table, not while standing over the sink. Avoid rushing meals when you are tired. Do not talk with food in your mouth. Be cautious with dry, crumbly, sticky, or tough foods. Keep sauces, broth, or moisture with dry meals so food is easier to chew and swallow during normal eating. And if pills are difficult to swallow, talk to your pharmacist or doctor. Do not crush tablets unless a healthcare professional says it is safe, because some pills are designed to release slowly or protect your stomach. These small habits are not about getting older in a fearful way. They are about staying independent in a smarter way. Because independence is not pretending risks do not exist. Independence is knowing what to do. Now let's repeat the emergency sequence one more time, slowly. If you feel food go down the wrong way and you can cough strongly, lean forward and keep coughing. Do not drink water. Do not lie down. Do not try to force another swallow. Let the cough work. If the cough becomes weak, if you cannot breathe, if you cannot speak, or if no air is moving, treat it as severe choking. Call emergency services if the phone is right there. Then immediately find a sturdy edge. Place the upper abdomen against it, above the belly button, below the rib cage. Bend over, thrust inward and upward. Repeat until the object comes out, air returns, or help arrives. If you become too weak to stand, lower yourself carefully if you can. Keep trying to create inward and upward pressure with your hands or against a firm surface. Keep moving. Keep acting. Do not simply wait. Air first. Action fast. That is the phrase I want in your mind. Not fear first. Not water first. Not embarrassment first. Air first. Action fast. And when the air comes back, do not ignore what happened. If choking was severe, if breathing still feels uncomfortable, if coughing continues, if your chest hurts, if your voice sounds different, or if you feel like food or liquid may have entered your airway, get medical help. It is better to be checked and reassured than to miss a problem that shows up later. I know this is a serious topic, but I also want you to hear the hopeful side. You are not helpless if choking happens when you are alone. You can learn the signs. You can prepare your eating space. You can keep your phone close. You can identify the counter before you need it. You can slow down your meals. You can talk to a professional if swallowing feels different than it used to. And you can share this information with someone else who may need it. That may be your spouse, your sister, your neighbor, a friend from church, someone in their 70s who eats dinner alone every night, someone who keeps their phone in another room, someone who has no idea that a kitchen counter can be used in an emergency. This is why we make videos like this on Built After 50, because the goal is not just to live longer. The goal is to live prepared, capable, and confident in your own home. If this video helped you, please hit the like button. It helps YouTube show this information to more adults over 50 who may need it. And leave a comment below with your age and where you are watching from. Are you watching from Florida, Texas, California, the UK, Canada, Australia, Pakistan, India, or somewhere else? I would love to see how far this Built After 50 community reaches. Also, tell me this. Do you usually eat alone or with someone else? Your answer may help another viewer feel less alone. And if you are new here, please subscribe to Built After 50 and turn on notifications. We share clear, practical, research-based health and safety guidance for adults over 50, without scare tactics and without confusing medical jargon. One last thing before you go. This video is for educational purposes only. It is not a substitute for personal medical advice, emergency training, or care from a qualified healthcare professional. If you have repeated choking, trouble swallowing, coughing during meals, unexplained weight loss, or any new swallowing problem, please talk to your doctor. And if you are actively choking or someone near you is choking, call your local emergency number right away. Your future self is protected by the small things you prepare today. So before your next meal, remember the scan. Phone close, sturdy edge, sit upright, small bites, and if the emergency ever happens, cough if you can, call if you can, counter if you cannot breathe. Air first, action fast. Stay safe, stay prepared, and I'll see you in the